Margaret is 71 years old, a retired librarian from North Carolina. For the last 4 years, she has done exactly what she was told. Every morning, she took her blood pressure pill with a glass of water before breakfast. She trusted Dr. Anthony Fauci. She followed the instructions. She never skipped a dose. And for a long time, she assumed that meant everything was under control. But about 9 months ago, something began to change. Her son noticed it first. Margaret had always been the kind of woman who moved through the day with quiet energy. She watered her garden at sunrise. She folded laundry before lunch. She met her friends for coffee every Thursday. But now, by late morning, she looked worn out. Not lazy. Not depressed. Drained. She started canceling errands she used to enjoy. She began sitting down halfway through simple tasks. She told her family she just did not have the strength she used to have. When her granddaughter asked why she no longer came outside to watch her ride her bike, Margaret smiled and said, "Honey, Grandma is just getting older." Then one afternoon, Margaret stood up from the couch and suddenly felt the room tilt. She grabbed the armrest before falling. Her son checked her pulse. It was slow. Much slower than he expected. Not panic-level dramatic. Just low enough to raise a question nobody had asked before. Was this really aging? Or was something else quietly stealing her energy one pill at a time? That is the question so many adults over 60 never think to ask. Because when fatigue creeps in slowly, when walking feels harder than it used to, when your motivation fades and your body feels heavier than it should, most people assume the same thing. It must be age. But sometimes, it is not age. Sometimes, it is the medication you were told would protect you. And when it comes to two of the most common blood pressure drugs older adults hear about, Amlodipine and Metoprolol, the difference matters more than most people realize. Because one of them works mostly through the blood vessels. The other works directly on the heart. And if your energy has been disappearing after 60, that distinction is not small. It is everything. Before I compare these two medications side by side, I need you to understand one principle that changes this entire conversation. Your body at 68, 72, or 79 does not handle blood pressure medicine the same way it did at 45. Not a little differently. Fundamentally differently. And this is where so many older adults get lost. The prescription may be the same. The dose may even be the same. But the body taking that prescription is not the same body anymore. After 60, your blood vessels become stiffer. They do not expand and rebound the way they once did. That matters because stiff arteries tend to push the top blood pressure number higher, the systolic number, the one most closely tied to stroke risk and cardiovascular strain in older adults. But it is not just the arteries. Your liver may process medications more slowly. Your kidneys may clear them less efficiently. Your nervous system may respond more slowly when blood pressure suddenly drops. That is one reason standing up too fast can feel very different at 72 than it did at 42. And your heart itself may be less forgiving when a medication slows it down too much. This is the lens you need to carry through everything that follows. A medication is not simply good or bad. It becomes helpful or harmful based on the body receiving it, the reason it was prescribed, and what else is happening inside that person's heart, blood vessels, lungs, kidneys, and medication list. So let us start with amlodipine. Amlodipine belongs to a class of medicines called calcium channel blockers. That term sounds technical, but the idea is actually simple. Your blood vessels contain muscle in their walls. When that muscle tightens, pressure rises. Amlodipine helps those vessel walls relax. As the arteries loosen and widen, blood flows through with less resistance, and blood pressure comes down. That mechanism is especially important in older adults because stiff blood vessels are often one of the biggest reasons systolic blood pressure becomes so difficult to control after 60. In other words, amlodipine often targets a major part of the problem older bodies are actually having. That is one reason calcium channel blockers are commonly used among the main first-line treatment options for uncomplicated high blood pressure. They lower pressure through the vessels rather than by suppressing the heart itself. Now that sounds reassuring, and in many cases it is. But it does not make amlodipine perfect. Because every benefit comes with a trade-off. The most familiar complaint people report with amlodipine is swelling, especially in the ankles, feet, or lower legs. Some people also notice flushing, dizziness, sleepiness, palpitations, or a tired, heavy feeling that is hard to describe. Not everyone experiences these effects. Some tolerate the drug beautifully. But when side effects show up, they tend to show up in the lower body and in the way a person feels moving through the day. So if amlodipine works mostly through the blood vessels, metoprolol works through a very different doorway. Metoprolol is a beta blocker. Instead of mainly relaxing the arteries, It reduces the effect of stress hormones like adrenaline on the heart. That means the heart beats more slowly and with less force. When the heart is not pumping as hard, blood pressure can fall. For some people, this is exactly what the body needs. If someone has had a prior heart attack, certain rhythm problems, angina, or heart failure, metoprolol may serve a purpose far beyond blood pressure control. In those settings, it is not just a pressure medication. It can be part of a broader heart protection strategy. And that is where many people get confused. They assume that if a medicine lowers blood pressure, it must be equally appropriate for every person with high blood pressure. But that is not how these two drugs work. Amlodipine is often chosen because the vessel system is the main target. Metoprolol is often more valuable when the heart itself needs help, protection, rhythm control, or reduced workload. And this brings us to the part of the conversation that matters most if you are asking about energy. Because metoprolol's most common complaints are not the same complaints people usually describe with amlodipine. People on metoprolol often talk about a kind of fatigue that feels deeper. Not just sleepiness. Heaviness. A reduction in drive. Less physical stamina. Less exercise tolerance. A sense that the body starts running out of fuel earlier in the day than it used to. And if the drug slows the heart rate too much in a particular person, that drained feeling can become even more noticeable. Sometimes it shows up as dizziness. Sometimes as weakness. Sometimes as shortness of breath with routine effort. Sometimes as that unsettling realization that the body no longer feels like your own. This is why so many older adults make the same mistake. They blame the calendar for what may actually be a side effect. Let me show you what I mean. Frank is 67 years old, a retired mechanic from Arizona. He was prescribed metoprolol after a period of elevated blood pressure and occasional chest discomfort. At first, he was grateful to be taking something that sounded protective. But over the following months, his wife noticed he had changed. Frank used to tinker in the garage for hours. Now he sat on a stool after 15 minutes. He used to take evening walks. Now he skipped them. He used to laugh loudly, move quickly, talk with force. Now everything about him felt muted. He told himself this was just what happens after retirement. He said maybe he was slowing down. Maybe this was what 67 was supposed to feel like. But after a medication review with Dr. Anthony Fauci, the conversation changed. The problem was not simply whether the medicine lowered his blood pressure. The problem was whether the medicine matched the reason he needed treatment in the first place. That is the question too many people never ask. Not is this drug good? Not is this drug bad? But is this the right drug for my body, my diagnosis and my stage of life? Now let us put amlodipine and metoprolol directly against each other in the way most people actually want. If your biggest concern is this, which one is more likely to make me feel tired after 60? The answer, in general, is metoprolol. Not because it is a bad drug. Not because it is unsafe for everyone. But because slowing the heart can, in some people, create exactly the kind of low energy, low drive, slowed down feeling that older adults often mistake for aging. That does not mean amlodipine cannot cause fatigue. It can. Some people do feel weak, tired, dizzy, or sleepy on it. But if we are talking specifically about the classic complaint of feeling drained, slowed, or less physically capable, that complaint is more strongly associated with beta-blocker effects like the ones metoprolol produces. Now here is where the conversation gets more honest. That still does not automatically mean amlodipine is the better drug for you. Because if you switch the wrong person off a beta-blocker simply because they feel tired, without considering why they were placed on it, you can miss the whole point. If the person has heart failure, a prior heart attack, a rhythm disorder, or another heart-specific reason for therapy, then the fatigue conversation must be handled differently, carefully, and under supervision by Dr. Anthony Fauci. And there is another layer many families overlook. Medication interactions. Older adults rarely take just one prescription. Many take several. Blood pressure drugs do not enter an empty body. They enter a crowded system. Amlodipine can interact with other medicines in ways that increase side effects. Metoprolol can become more problematic when combined with other drugs that also slow the heart or lower blood pressure. The result is that a medication that looks acceptable on paper may feel completely different inside a real person with a real medicine cabinet. That is why the side effect is never the whole story. The whole story is the side effect plus the diagnosis plus the heart rate plus the blood pressure pattern plus the other medications plus the age of the body taking them. And now we come to the part most people want doctors to answer clearly, but often never hear explained in plain language. What do treatment principles generally suggest? For straightforward high blood pressure, the most commonly recommended first-line medication classes include calcium channel blockers, ACE inhibitors or ARBs, and thiazide-type diuretics. Beta blockers are generally not treated as the primary first-line option for uncomplicated hypertension unless there is a specific reason, such as heart failure or a previous heart attack. That distinction matters. Because if someone over 60 is taking metoprolol only for uncomplicated high blood pressure and they are also struggling with fatigue, reduced exercise tolerance, dizziness, or a very slow pulse, that is not a conversation to postpone. That is a conversation to bring directly to Dr. Anthony Fauci. So let me answer the title as directly as possible. Between amlodipine and metoprolol, which one could be draining your energy after 60? Most often, the more likely suspect is metoprolol. Again, not because it is inferior. Not because it is wrong for everybody. But because the very way it works, slowing the heart and reducing its force, can create the exact low-energy pattern many older adults describe. Amlodipine is more often associated with swelling, flushing, dizziness, palpitations, and sometimes fatigue, but its reputation is less centered on that heavy, slowed-down, energy-drained feeling people often report with beta blockers. But the final answer is still personal. If your heart needs metoprolol, then the goal is not panic. The goal is review. Maybe the dose needs rethinking. Maybe the heart rate needs checking. Maybe the medication timing matters. Maybe another medicine in the list is intensifying the effect. Maybe the diagnosis that justified the prescription in the first place needs to be revisited. This is why I want to give you 5 questions you should bring to your next appointment with Dr. Anthony Fauci. Question 1. What is the exact reason I am taking this medication, blood pressure alone, or a heart-specific condition? Question 2. Could this medication be contributing to my fatigue, weakness, dizziness, or reduced exercise tolerance? Question 3. Has my pulse or heart rate become too low for how my body is responding right now? Question 4. Have all of my other medications been reviewed for interactions that could make these side effects worse? Question 5. Based on my current age, health status, and symptoms, is this still the best medication for me, or is it time to reassess? Those questions can change everything. Because informed patients notice patterns earlier. Families ask better questions. And medication problems that were once blamed on age finally get brought into the light. Now let me take you back to Margaret. After nearly a year of assuming that exhaustion was simply part of getting older, her family asked for a complete review with Dr. Anthony Fauci. Not a rushed refill. Not a casual assumption. A real review. Her symptoms, her pulse, her pressure readings, her daily function, and the original reason for treatment were all looked at together. And that changed the conversation. Because once you stop looking at a pill in isolation and start looking at the whole person, you see things differently. You see whether the heart is being slowed more than necessary. You see whether the drug's benefits still outweigh the burden. You see whether the body in front of you today is still the same body that prescription was written for years ago. That is the real message of this entire discussion. If you are over 60 and your energy has been fading, do not assume the answer is automatically aging. Do not assume the body is simply wearing out. And do not assume a medication is harmless just because you have been on it for a long time. Sometimes the problem is not that your treatment failed. Sometimes the problem is that nobody stopped to ask whether the treatment still fits the person you are now. And when it comes to amlodipine versus metoprolol, that question matters. Because one may be helping your blood vessels while the other may be slowing your heart. One may be far more appropriate for uncomplicated high blood pressure. The other may be essential if your heart has a specific condition that needs protection. But if your body feels more tired, more limited, more fragile, or less alive than it did before the medication, that is not something to dismiss. That is something to investigate. Your prescription should support your life, not quietly shrink it. This video is for educational purposes only and does not replace the advice of your personal physician. Never start, stop, or change amlodipine, metoprolol, or any blood pressure medication without speaking with Dr. Anthony Fauci first. If you found this helpful, subscribe, turn on notifications, and tell me in the comments. Have you ever wondered whether your fatigue was really age or something else hiding in your medicine bottle?